Hello. So in this video I wanted to share with you the treatments and procedures that I've been through since the beginning of my breast cancer journey in 2012. So in 2012, of course I had the core needle biopsy, which I in a previous video said do not ever do if you can avoid, just have a lumpectomy. After that, I had a mastectomy for the left side with no reconstruction, which I do not regret. And then I had the right side also removed because I just more of a prophylactic thing. And besides, having only one boob was really weird. So I have no boobs, and again, I don't regret. Think about it, ladies. No boob sweat, no bras. It's kind of weird at first, but you get used to it. And I'm glad I don't even miss them. So after that, I didn't do any treatment for 3 years. And then when they found the cancer, in the bones and everything, we had the ovaries removed after we did another biopsy on the hip to see if it was still hormone receptor positive, which it was. After 3 years, it didn't change. And so they took the ovaries out, and the ovaries did have cancer in them, along with everything else, it seems like it. And then I went on tamoxifen, which didn't work at all. But once we had the ovaries out, that really shut everything down. Like the cancer went bye-bye. It was night and day. And one of these days I'll find those DVDs and upload that video too, like before and after. So I had the ovaries removed. I still have my uterus, so that's still there. But then, okay, so tamoxifen didn't work. Then they put me on xgeva, which is an anti-reabsorptive for the bones. So it helps keep the cancer from destroying the bones. It keeps the bones stronger, but it's not like an anti-cancer, just so we're clear on that. There's more, do some research on that. Then I also went, after the tamoxifen, I was on letrozole, which is an aromatase inhibitor. And that one has worked very well for me for the last 3+ years. And then shortly after that, I started the Ibrance. And that was, that's still going, but it may be coming to an end because the last few scans are starting to show some slow progression. And when I get my scan from the DVD from my last scan, I'll get to see how much progression really is going on, and whether or not, I think my appointment is in April, to see if we're maybe going to be switching to Piqray, which is a new PI3KCA mutation specific drug, which I have that mutation. And there's a Facebook page for that, the Piqray group, and it kind of tells you their side effects, and I'm not really looking forward to it because one of the major side effects is a rash, and I'm not looking forward to that. It's like an allergic reaction, hive type of rash, super itchy. And then the other major side effect is high blood sugar, which I haven't had problems with that, but kind of the clues I've been getting from my oncologist is that if you kind of come in to the drug with a insulin resistance, you're more likely to have the blood sugar issues, but I don't have that, confirmation for sure. But nonetheless, I mean, switching drugs is always kind of nerve-wracking. And for some of the women in the group, the drug works wonders. And for others, it does absolutely nothing. I guess about 40% of the women respond to this new drug. So now that my Ibrance is probably coming to an end pretty soon, which is fine. It's been 3 years. It's, an average of 2 years of response. The Piqray is next. After the Piqray is taxol. Then she's going to switch me to something else after that and come back to taxol, and then do another drug and then come back to taxol. And then, if nothing else comes down the line, I'm out of luck. So we kind of take our time here because we're running out of ideas. That is if I can continue to be hormone receptor positive. So those are the things I've done. I don't think I'm forgetting anything. I did try exemestane, and it did not work for me. That's an aromatase. It's not an inhibitor. It's like an inhibitor, but I can't remember what the exact word for it was. But it's a steroidal one, and it did not work for me. My body did not like it at all. So that seems like about the time that my autoimmune disease popped up too. So who knows, maybe it would have been working if that didn't come up. I don't even know if that might have triggered it. I really don't know. But after that, I went back on the letrozole, and so hopefully, you know, things will look better in my next scan. If not, then definitely switching to Piqray afterwards. So on the letrozole, very, little, feet aches, little achiness, but not terrible. It's manageable. The Ibrance, does make you tired. But what I did though, however, I started at the 75 milligrams and then went up to the 100 and then up to the 125, and that seemed to really help. And I'm seeing a lot of women who are doing the Piqray, the new mutation medication for breast cancer. They're having more success by starting off at the, was it the 100? I can't remember what the low, I think the 150 is the lowest starting dose for that, and they want you to go up to 300. So there's something else to consider too, is a lot of these medications, they try to make everybody take the same dose. Well, not everybody has the same amount of tumor burden or the same immune system. So why do we all have to start the highest dose right off the bat? So if you think that your body may not respond well to the medication, talk to your doctor about maybe starting at a lower dose and then working your way up. And it did help me. So anyway, that's a quick rundown of all the different medications I used and what's coming up for me. If you have any questions about any of the medications I talked about, I can try to share with you, how I reacted to them and, what you might be able to expect. Anyway, thanks for watching. Bye.